Hello, I'm Dr. David Loh, and today I'd like to tell you everything you need to know about fat transfer, a procedure that's also called fat grafting or lipofilling. Fat transfer is a procedure where we use fat that is extracted from the patient during liposuction and transplant it to another part of the patient's body to augment or to enhance it. In the face, it can be used to plump up the face like a filler, but there are differences. In the body, it can be used to augment the breast, the buttocks, or to correct areas of liposuction defects, but there are caveats, which I will go to in this video. Let's talk about the different indications, which I will divide into face indications and body indications. In the face, we can extract fat and transplant it to an area of the face that has begun to atrophy. In my 2018 paper, I explained that by reinflating specific fat pads that have begun to atrophy with advancing age, we can restore the tension and integrity of the mass and correct mild degrees of facial sagging. That paper was based on high elasticity hyaluronic acid, but fats will do as well, which begs the question, are fat transfer and HA fillers interchangeable? So head-to-head comparison, fat transfer versus HA fillers, are there any differences? Firstly, the consistency of fat is quite different from HA fillers. The HA fillers can vary from being very liquid to very stiff. It can be used to rehydrate the skin. It can be used to plump up the face. It can be used to lift sagging skin. It can also be used to project central features of the face like the nose, lips, and chin. However, fat grafting, fat transfer is only good for volumizing the face and only very occasionally can be used to lift sagging skin. Fillers come in sterile, pre-filled syringes, whereas with fat transfer, we need to extract fat from another part of the body through a process called liposuction. So as you can imagine, the recovery time is quite different. Fat should only go where fat belongs. While fat grafting is useful in areas that have begun to atrophy, like the ones I've mentioned in my paper, they are not the same as, they're not a direct replacement for dermal fillers. Areas of central projection, like the nose bridge, the columella, the lips, and the chin, are better off treated with hyaluronic acid fillers than with fat transfer. Depending on the blood supply of the recipient area, the fat retention rate can vary a lot from maybe 30% to 70%. This variability in survival rate of the transplanted fat makes it very unpredictable. Whereas for HA fillers, almost what you see is what you get, and for the long term. Also, because of this variability, sometimes in the long run, we will still need to use some HA fillers to do some touch-ups, even after having done fat transfers. Let's talk about body indications now. Fats can be used to enhance the contours of the breasts and the buttocks. In this case, a lot of fat is required, and a full liposuction of another part of the body, usually the abdomen and the flanks, or the inner and outer thighs, is needed to find enough fat to transfer. So after the liposuction, the work begins to process the fat. The extracted fat will be subjected to a separation process using a tulip filtration process. In the process, we extract the microfat, which are the medium-sized particles that are known to survive best when transplanted, as well as the smaller-sized particles called nanofats, which are sort of like the stem cells in fat, and when combined together and transplanted, the survival rate is very good. Useful areas that we transplant to are the breasts, the buttocks, and areas of liposuction defects, like I mentioned before. But there are caveats. In the breast, pregnancy and breastfeeding often brings about a lot of volume changes. So it is pretty useful to use fat transfer to restore some volume, unless there are a lot of sagging issues. Fat transfer is also useful for girls with underdeveloped chests, and this minor amount of addition to the breast will make all the world of difference to them. In the buttocks, we can enhance the curves and give patients more confidence regarding their body's appearance. But this area needs a lot of fat to augment. Which brings us to the next question: who can do fat transfer? Enough fat is an important criterion. If we are transferring to the face, it does not need a lot and most people will qualify. If we are transferring to the breast or to the buttocks, it is a different matter altogether. The irony is that people who need the fat transfer most are also the people who are thin, and in this case, they do not have enough fat for the transfer. What is the fat retention rate like, you might ask? Of course, it depends on a lot of factors, like the blood supply of the recipient area. Usually the face, the blood supply is pretty good, and retention rate is quite high. Another factor which affects the survival of the fat is how fibrous the donor area is. And fibrosis can result from previous liposuction. It can also result from previous procedures like co-sculpting, ultrasonics, those non-invasive body sculpting kind of treatment. In which case, if there's a lot of fibrosis in the fat that we extract, we have to use more effort to filter off the fibrous tissue, and then the survival rate of the fat decreases. Of course, the other general factors like age, smoking, and lifestyle also affects it. But generally, what we can expect from a fat transfer procedure is somewhere between 20 to even 70-80% kind of survival retention rate for the transferred fat. What happens to the fat in the long term, you might also ask. After about 1.5 months, whatever retains will remain forever, means long term. Meaning the ones that didn't survive the transfer had already been washed away, and whatever stays will stay for the long term. And what happens to these fat cells is that if you put on weight, it will also re-expand. If you lose weight, it will also shrink, behaving as if it was still in the donor side of the body, meaning the abdomen or the thighs. Can I transfer as much as possible, you might ask? No, the answer is you should not, in the sense that over-lipofilling causes oil cysts to form. Remember that fat cells that are transplanted also need oxygen supply to survive. Overcrowding the area will cause the fat cells to die, and the body will naturally encapsulate these pools of oil to form cysts. These cysts are harmless, but they are a nuisance as they will cause unnecessary alarm during health screening in the future. So there's an optimum amount which can be transferred to each area, which depends on the method of fat extraction and also the separation that the surgeon uses. This optimum amount will avoid having oil cysts and still give adequate results. We hope to have gained a better understanding of the topic of fat transfer in this video. Do visit our website for more in-depth information regarding this topic. I thank you.